Good afternoon, everyone. My name is Catherine Foley, and I'll be facilitating the briefings this week. From today's briefing, you will hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor for the Medical College of Wisconsin and Director of Medical Services for the Office of Emergency Management, Marlena Jackson, Interim Commissioner with the Milwaukee Health Department, Patricia Obluck, Associate Organizer for Common Ground, and Dr. Mariana Rincon, physician at the 16th Street Community Health Center and Common Ground volunteer clinician. County Executive Crowley, we'll start with you.
Well, thank you so much, Catherine. So today I want to start off by reinforcing one of the messages that we talked about on last Thursday's briefing, which is vaccination for folks ages 65 and older. It has started in some parts of the state, but I want to highlight the difference between being eligible and what is available. And so some counties throughout the state have started this process of vaccinating individuals the age of 65 and older. But when you look at Milwaukee County, we are the largest county in the state. And many of our healthcare providers and local health departments are still focusing on vaccinating folks within that 1A group. And so they're making great progress right now, getting shots in folks' arm, but there's still a lot of work to be done. And so with that being said, I want folks to understand that it is our ability, the county's ability to vaccinate more people is also hindered by the limited number of vaccine doses available. So we want to make sure these doses are getting in folks' arms, but the doses aren't available as we thought they were. So last week, the Wisconsin Department of Health Services Deputy Secretary Willems Van Dyke, she talked about about perseverance, and I want to echo her sentiment. And so in March, it would be a year since this pandemic started, and we've come so far, but we're not out of the woods yet. And I understand that there is a lot of eagerness for folks to get the vaccine. I share that eagerness as well, but we need to persevere and hold tight for the time. And so when we are eligible and the vaccine is available, we can get those shots in folks' arm. And so there is light at the end of the tunnel, and I want folks to know that. And so we don't want folks to give up. But for now, if you want to stay informed, you can sign up to receive alerts about the vaccine availability, and you can visit healthymke.com for that information. But also you can watch for different updates from your local health departments as well. So let's continue to be vigilant. Let's continue to wear our masks, wash our hands, and watch our distance. And together we will persevere through this. But we also have some good news to share here in Milwaukee County. Today, we secured $10 million in funding for housing assistance. And these funds will really help to protect some of our most vulnerable residents from being evicted, but also assisting with mortgage as well. And this is always important, but especially when you think about some of our coldest months are ahead of us right now. And so though this is great news, I also want to say that, at the current rate of spending, we only anticipate having these funds up until the middle of the year. So it really lets you know that there's still a need for more funding to meet the full needs of everybody here within Milwaukee County. So with that, I'd like to hand it over to Mayor Barrett and appreciate his leadership and collaboration throughout this whole year.
Well, thank you very much, Mr. County Executive, and thank you for your leadership as well. Good afternoon. A lot of attention right now is going towards vaccination, as it should, as we're all eagerly awaiting a larger supply. But we're also focusing on testing, and I think it's important for us to keep that focus on testing, because that's one of the fronts in this war that we have to continue to fight. And unfortunately, we have seen a decrease in the number of people who have been tested. If you are having the symptoms, or if you have had contact with individuals who are COVID positive, please make sure that you take advantage of one of our sites. As of yesterday at American Family Field, the old Miller Park, we had 899 individuals. At the Northwest Health Center, we had 279. And at the South Side Health Center, we had 157. So each of those locations can certainly handle more people. Now, unfortunately today, all 3 community testing sites are closed due to the weather. I think people understand that. And the Milwaukee Health Department has also closed the Wisconsin Center vaccination site due to the weather. But I want to note that no vaccine doses will go to waste because of this closure. Individuals who had appointments to be vaccinated today will be rescheduled for later this week. So people don't have to be concerned, given the short shelf life of the vaccination, that these vaccinations are going to go to waste. They will not go to waste. We expect these locations to open back up again tomorrow, January 27th. I just got off a call about vaccinations, a vaccination update, and we know everyone in the vaccination distribution process is working in good faith to get as many people vaccinated as possible. I understand, and I personally would love to get the vaccination. I am older than 65. I would love to get the vaccination as quickly as possible, as I'm sure many people would. The Milwaukee Health Department and I want to get as many doses into as many arms as efficiently, as safely, and as quickly as possible. That's why we've scaled up the Wisconsin Center vaccination site, and we're ready to handle more people. But I think everyone on this call and anyone who's followed this closely knows that a huge part of the challenge, as the county executive mentioned, is the supply issue. And that is getting more vaccinations into the state of Wisconsin. The population of people over 65 in the state of Wisconsin is approximately 700,000 people. The number of doses that we received this week is approximately 70,000 doses for the entire state. That clearly creates a problem, a demand and supply problem that will continue until the number of doses coming into the state of Wisconsin increases and increases rather dramatically. But we also have an obligation, I believe, with the supply we're getting to make sure that these doses are being distributed equitably. And we have all talked about the racial disparities in our community. We've talked about the challenges that we have with the social determinants of health. And right now, what we are seeing in the initial distribution of vaccine is we're seeing a continuation of that racial disparity. Now, some of that is due to the fact that the initial supply went to the healthcare providers, many of which are not located in neighborhoods where people of color live and don't have a lot of people of color who are working for those institutions. But I think we, particularly those of us who are in positions of responsibility, have an obligation to know that everyone, and this is not prioritizing, this is just fighting for an equitable distribution. This is not saying one group should get more than the percentage. If we had the distribution along the percentage lines of our population, that would look far better than it is right now. But we know people of color and economically disadvantaged people are less likely to have connections to major health systems. So as these systems start vaccinating their patients, the disparities will continue. And one of the issues that we talked about in the call I just got off are the federal qualified health centers and the need for them to have a larger role in this because they are located in the neighborhoods that are chronically underserved and historically underserved. And I think the whole notion that the vaccinators will be evenly distributed is not necessarily accurate because we also know that you're going to have a lot of healthcare providers that are not going to be located in these economically distressed neighborhoods. So as vaccination efforts expand, every level of government and all of the healthcare partners have to make sure that systemic disparities do not leave people of color unvaccinated. We cannot allow these disparities to continue. It's been clearly a topic that we've talked about extensively through 2020 and 2021. And this is where we're tested. Are we going to be able to do this? Do we have the will to do it? And I want everybody to get this vaccination. And I want it to be done in an equitable fashion. So we've got a lot of work to do, but a lot of people of goodwill, I think, are trying to do the best they can in very, very challenging situations. And with that, I'll turn it over to Dr. Wesley.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we have had 93,433 confirmed cases of COVID-19 in our community and 978 individuals who have died in Milwaukee County. And we will have updated vaccination numbers posted to the county dashboard tomorrow for our weekly update. And we're certainly working with the state to get vaccine data more frequently and in more detail in the near future. In our overall trends, we continue to be cautiously optimistic with regard to our trends in cases and hospitalizations and in deaths. And our percent positive is now down below 8%. Although vaccine supply is clearly tight at a national level, we continue to get increasing amounts of vaccines into the arms of those who have been approved by the state. And our health systems in particular have been reaching out to the 65 plus age group And our three largest health systems, Advocate Aurora, Ascension, and Freighter in the Medical College of Wisconsin, have scheduled tens of thousands of appointments in this population in our area. And as we're speaking here, vaccine is getting into the arms of those over 65 or those 65 and older, as the health systems work with the federally qualified health centers and our local health departments and community vaccination sites to rapidly vaccinate as rapidly as possible, given the supply constraints, this critical population. Shifting a bit, there's been a lot of discussion over the new strains of the virus that causes COVID. So I wanted to clarify a few issues and very real concerns around that topic. The virus that causes COVID, like all viruses, undergoes constant minor mutations as it replicates in our bodies. And most of those mutations make no difference to how the virus works. However, there's been 3 strains around the world that resulted from a series of mutations that have become noticed, in particular due to their increased dissemination throughout the world and their heightened ability to infect and spread. So these 3 are the UK variant, the South Africa variant, and the Brazil variant. Each of them appears to bind better to our cells, making them more easily transmitted person to person, or put simply, they're more contagious. In particular, the variants in South Africa and Brazil appear to also be able to avoid the antibodies that have been created from previous COVID infections. This means that people who've been infected with COVID in the past may be more prone to reinfection from these variants. So the big question, of course, is whether the vaccine is still effective against these different variants. And in the case of the UK variant, there's no reason to think that it would not be effective. Although it's more transmissible, that variant is still neutralized by the antibodies developed by infection as well as vaccination. However, the South Africa and Brazil variants are more of a question. The immunity provided by the vaccine is certainly more durable, that is stronger and longer lasting than what we see from natural infection. So we would expect that the vaccine would still be effective even against these variants, though perhaps not quite at the extremely high 94, 95% effectiveness that we see against the more conventional strain of COVID. So there's more research that needs to happen on these fronts. But finally, while the UK variant is likely very widespread in the United States, the Brazil variant was first confirmed yesterday, and that was a case in Minnesota. And the South African variant has not yet been detected in the United States, and we certainly hope it stays that way. So a lot of information to take in there. I think the take-home points are there's 3 main variants of the virus that have been discovered around the world, or 3 new variants. Each of these are more contagious than what we've seen previously. And 2 of them may also be less susceptible to antibodies from past infections. But how effectively the vaccine will prevent the strains is yet to be determined, but it is still expected to be high. So this will be a particular area of the pandemic to keep a close eye on. Perhaps the most important take-home point overall is that despite the mutations, despite the variations, our precautions should not change at all. We should still mask, we should still distance, we should still avoid gatherings, and certainly we should still receive the vaccine when it's offered to us. And each of these steps will be effective against the conventional COVID and provide significant protection against these new variants as well. Thank you very much. Stay safe, and I will hand it to Commissioner Jackson.
Thank you, Dr. Weston. So I'm going to start today by giving some general vaccination statuses for the City of Milwaukee Health Department. So for this week, starting yesterday, January 25th, our goal was to vaccinate 2,200 individuals in our Group 1A. That is down just based off of, as you've heard in prior information here, that our supply is down for what we have been allocated for the City of Milwaukee. And so we plan to vaccinate around 2,200 individuals this week. Knowing that that our supply is very limited, we are doing our best to figure out how do we add our 65 plus individuals into our vaccination schedules, understanding the need as well as the the effect that COVID has on the 65 plus group. So beginning next week, actually February 1st, we will begin vaccinating a limited number of individuals who are 65 plus. And through this first week for February 1st, we will be contacting individuals that have already been registered with the city of Milwaukee to get on our current schedules. We are in the process of finalizing our new electronic scheduling system, and that will allow us to schedule larger volumes of individuals. And we're also working on a hotline to make sure that that is staffed up so that individuals who don't have internet access would be able to call our hotline to schedule if they need help with registration. So our goal is to have our new registration site up as well as our hotline up later next week. And so we will get that information out again, specifically for our 65 plus group. Again, understanding that we do have supply issues at this time, our plan is that we will be reserving at the Wisconsin Center Mondays as our official day to vaccinate our senior population. So we are working to make sure that we have all of our needs set up there, as far as wheelchairs that have been donated to the health department, as well as other things to really help facilitate really smooth processes on those particular Mondays. So again, starting next week, we will begin our 65 plus, and we're excited to do that, understanding that it is truly limited numbers, but excited that we can start somewhere. And then moving forward, once we get our registration system up, we will share it with this group, as well as others, to make sure that registration, whether it be by phone or online, is easy and accessible to all. So I also want to just give a quick update on our Moving Milwaukee Forward Safely orders. So our current percent positive for the city of Milwaukee is 7.7%. And the last time our numbers were around 7 was late summer. And so we have seen a slow decline for the percent positive over the last month, which allows us as a city health department to really look at where our current order stands and our ability to look at updating that. So we'll continue to follow the science. We'll continue to follow our data as we make updates to that order. And so you can anticipate in the next week or two that we will have updates to that current order. We don't anticipate that they will be large, significant updates, but definitely some changes that we think we are able to do based off of that percent positivity. And that's the information I have. So now I will turn it over to Patricia.
Thank you, Commissioner. And good afternoon, everybody. So I wanted to talk a little bit about the Common Ground Community Health Team. And the Common Ground Community Health Team was created by Common Ground, which is an alliance of 40 churches, schools, and other institutions working together for the common good of all throughout Milwaukee. You can learn more about our organization at our website, which is commongroundwi.org. The Common Ground Community Health Campaign is a phone call follow-up program. It involves over 25 volunteers who make calls daily to patients to check on them, 18 clinicians who volunteer their time to be on call just in case a patient needs extra support, like Dr. Rincon on the call here, and 2 technicians who handle the opt-ins and delivery of the pulse oximeters to patients. This program is designed to help provide patients support and reassurance, while also helping with decision-making based on symptoms, pulse oximetry, and heart rate. If a patient opts into our program, they are called daily for 10 days, or more if they're still feeling poorly, or less if they return to work or their quarantine is up. Having the same volunteer call daily helps to build trust, which is really important when someone's facing a virus like COVID-19. Patients access the services by opting in when offered by the case investigators at the City of Milwaukee Health Department. Every person who tests positive with COVID-19 is offered the option to participate, and if interested, we are given their name and phone number on our opt-in line. Then we take it from there and ensure the program is one that will benefit them, drop off a welcome package, and assign them a volunteer. This program is completely free to patients and has been funded on our end through AHEC, the Greater Milwaukee Foundation, individual donors, and we are also currently looking for additional funding opportunities. The most common questions or concerns our volunteers help people with are really around symptoms. The most obvious symptom we get many questions around is shortness of breath. For example, many patients feel nervous when they are short of breath after walking to the bathroom and back. By providing them with a pulse oximeter and teaching them how to use it, our program helps to lessen this concern since they can check their oxygen saturation level anytime they want. Every patient is different and comes with different concerns. One of the strengths of this program is that the volunteers build a relationship with the patients and really take the time to have conversations with them. If a patient is feeling nervous or anxious, they know that every day someone who cares is going to call them and check in on how they're feeling. So far, we have helped over 600 people, and every day we continue to opt in between 4 to 6 patients. And we plan on continuing to offer these services as long as there is a need for them. Now I'm going to hand it back to Catherine.
Thank you, Patricia, for joining today. At this time, we will actually move into the Q&A portion with our media. And as you noted, Dr. Rincon is available on today's call to help answer questions. Our first question is from Sharon Bajenda with CBS 58, and it's for Dr. Weston, the mayor, and Marlena, or Commissioner Jackson. The first question is, do you know when it will be safe for kids to get vaccinated? Where are we in the process of the vaccine trials, if any, for kids? That's the first question.
Sure, I can comment on that. So the current vaccines go down to age 16. Certainly it's going to be important to figure out how to vaccinate ages less than that, both to achieve herd immunity, as well as we're seeing in that 10 to 19-year-old age group, there are higher levels of transmission than 0 to 9-year-old age group. So certainly those studies are ongoing. They're ongoing for the current vaccines as well as future vaccines that are being developed. And we'll continue to watch that research and follow the science closely.
Thank you. And for the second question, perhaps Commissioner Jackson, you're able to answer this. How many appointments were canceled at the Wisconsin Center today?
So we canceled around 300 appointments today. Starting earlier this morning, the Wisconsin Center staff began to call every single individual on that schedule and get them scheduled for this week. So the individuals that were not seen today will be seen this week. And I think it's also important to know we got lots of thanks for canceling, because there were a number of individuals who had not planned to come, obviously to come out in the snow based on safety reasons. So we were able to get everyone in who wanted to get rescheduled for this week.
Excellent. And Sharon's third question is, how many updates, or are there any updates of what groups are being considered for vaccines in the next phase?
So I'm not sure if next phase we're talking about the next level of 1B or 1C, but the next level of 1B, the DHS has released, I believe they've released who that'll include, and that includes folks such as those in education, those staffing 911 centers, those in other critical infrastructure type jobs. And then 1C is still being determined. That'll be determined at the state level and then approved by the state, but it's expected to be those with more high-risk health conditions.
Thank you. Our next question is from Ben Wagner with WISN 12. He asks, the Wisconsin State Senate is discussing striking down the state's mask mandate. If it's ultimately successful, would Milwaukee County continue its own mask mandate?
So we are really lucky in the city of Milwaukee that we have elected officials, our mayor, including our common council, that have supported our efforts for COVID-19 since the beginning of the pandemic. And one of the great things that our common council did was to vote on this ordinance for mask wearing. And so what that means is that because the legislation that was passed today specifically was for health officers, the fact that our mask mandate was passed through ordinance through common council means that we are able in the city of Milwaukee to keep our mask mandate.
And just to echo that, there have been legal challenges in other counties and other communities. And that's why we specifically met with our city attorney, why we decided that we would go through our elected common council so that it would be basically immune from a legal challenge. And that was a very successful strategy. Moving forward, what we're going to continue to do is we're going to continue to rely on the healthcare experts because we think that this remains a healthcare crisis and we want to work with our healthcare experts. So We are going to continue our mask ordinance in the city of Milwaukee, regardless of what the state does. I think it would be unfortunate and a highly partisan move to take away this mask at this mask rule at the state. But unfortunately, partisan politics has clearly poisoned this debate. A debate that should be about healthcare, should be about public health, has now become a debate over politics in partisan politics.
And I would just say it is unfortunate that we are having this conversation right now, but here in Milwaukee County, we will continue to have our mask mandate when you're on county grounds and county property and things of such. But we don't have a county-wide mask mandate in the sense that the city of Milwaukee or other municipalities may.
Thank you all for the update. Ben has a second question. He says, for Dr. Weston on the new variants, is there any worry their increased transmission rates could lead to a fourth wave of infections, given that people previously infected could become ill again?
This is absolutely a major worry with the new variants. So when you see the increased transmissibility, we worry, much like happened in the UK, that our case rates and inherently from that, our hospitalization rates and our death rates could rise dramatically. We saw that there, and we certainly worry about seeing it here if that becomes widespread. On the other hand, we also worry, as you're mentioning, about the immunity. Could it be that people who've already gotten the infection can get this again? And so that combination of increased transmissibility and less immunity for those who've been sick absolutely raises a concern for another wave of infection.
Our next question comes from Sam Kramer with Fox 6, and it's for Commissioner Jackson. You mentioned you're looking at minor changes to the health order. Can you give us insight on what those changes are?
Yeah, so at this point, those decisions have not been finalized. So I would not want to at this point comment on what those updates and changes are. Again, as soon as we have a final order, happy to share.
All right, you can stay on because the next few questions are also for you, Commissioner, and they come from Allison Durr with the Milwaukee Journal-Sentinel. The first one is, how many doses of the vaccine did Milwaukee receive this week versus how many it had requested?
So last week we requested a little around 5,000 total doses, and we received that 2,200 that we shared. So we will be giving out all the vaccine that we received this week.
Next question is, how many people ages 65 and older does the city expect to be able to vaccinate per week at this point?
So that number really remains to be unseen. What I can tell you is for next week, we're looking at around 700 to 1,000 individuals. However, this is all based, as we have shared already, on supply. And so every week we look at what we can fit into our schedules, first doses and second doses, because we also have to fit those second doses in. So right now for this first week, we're thinking around 700 or so. And then moving forward on those Mondays, it's really going to be dependent on our vaccine supply. So know that there are definitely going to be times where schedules will be full or individuals might find challenges to get in, and it will be a practice of coming back every week to sign up and getting a slot.
And our final question is for anyone on this call who can answer. Allison asks, what have municipalities in the county been doing to push the state to allocate more vaccine doses here? What reasons have the state officials given for not allocating more vaccine to the Milwaukee area?
Well, you can be sure that both I and the county executive are doing everything we can to get as many vaccinations into Milwaukee County, and in my case, the city of Milwaukee, as humanly possible. And I wouldn't even call it resistance. The reality is it's going to be based on how many doses the state receives. But again, I'm just coming off a call where I was talking about the social determinants of health and the need to make sure that people who have been historically underserved are not put at a disadvantage by the distribution that we're currently seeing. So I'm doing everything I can, and I will continue to do everything I can to get more vaccinations in the city of Milwaukee. And I have every confidence in the world the county executive is doing exactly the same thing.
I have nothing really to add other than I totally agree with the mayor. We're doing everything that we can, but again, if the state isn't receiving the amount of doses that it needs to put these shots in folks' arm, it makes everybody behind the 8 ball. And so we got to continue to put, talk to the state, but we're all waiting to see what the federal government is doing to make sure that we properly have the amount of doses needed to vaccinate those who want to be vaccinated.
Thank you both. And the final chat I'm seeing is from Sari Lesk with the Milwaukee Business Journal. She's asking Commissioner Jackson, can you clarify the schedule for vaccinations moving forward? What will happen Monday if it's reserved for 65 and plus, and then what happens the rest of the week?
Right. So right now, Mondays are going to be our designated 65 plus day. We understand this is a huge population of individuals. And so our goal was to really set aside some designated time for that group, understanding that we continue to vaccinate individuals in our 1A group, and understand moving forward that will also increase to others in the 1B. So we still have to have and create capacity for our other 1A. Right now it's 1A and our safety and security groups, understanding as we move into that 1B, whether it be education and daycare or other essential workers, we have to also have capacity for that group as well.
Thank you for that additional clarity. At this time, those are all the questions I'm seeing in this chat. Thank you all for being here. Thank you, Patricia and Dr. Rincon, for joining us today. And we'll see you all on Thursday.
Thanks, everyone.
Take
Thank
care.
you.